Estrogen is the hormone for proliferation. In the body, we have two receptors, estrogen receptor 1 and estrogen receptor 2. Estrogen receptor 1 is proliferative, but estrogen receptor 2 is protective. For example, they increase the bone mass, they help cardiovascular, and they also help the brain function. So when you talking about hormone replacement therapy, if that hormone too much stimulate the estrogen receptor 1, then they increase the risk of breast cancer. And this is true that some oral contraceptive pill using for a longer period of time may a little bit increase the breast cancer risk. And also exposed to things like xenoestrogen, the phthalate or the plasticizer also increase the breast cancer risk because it can stimulate your tissue every day stimulate, and then you increase the breast cancer risk. Some hormone replacement therapy like bioidentical hormone replacement therapy, including determine or measure the estrogen metabolite and then looking for a way to reduce the bad metabolites and to improve the good metabolite. That can also turn the hormone become protective, because when we're talking about estrogen, actually their metabolite, they have two metabolites, at least two groups of metabolites. One group of metabolites is stimulate and increase the cell proliferation, but the other group, it seems to be protective.